work at Kakamega General Hospital. I'm the Antimicrobial Stewardship Chairperson in that hospital. I think most of you are wondering what we are doing today. Today is actually a very important day in the world. We are celebrating what is known as Antimicrobial Resistance Week. So what that means is we are trying to educate, advocate, and act in manners that the entire world should be aware of this big concept that we're trying to put across. So many of you might ask what this concept is all about. We are trying to educate the masses on the dangers that have been brought forth by the misuse of antibiotics, antivirals that have been around for quite some time, and that has made a lot of changes within the environment, and that increases our risk of developing very severe infections and even eventually dying. Yes.
Maybe you feel like some of
Many. Remember, I've mentioned rightfully the risks are majorly brought by us human beings. So one of the risks are there are very severe infections that can come across because of resistance to these antibiotics that have been around for quite some time. So once you get an infection with this organism that is resistant, then it's very difficult to treat it, and it leaves the healthcare workers with nothing else to do, and there are no available antibiotics currently being developed to treat this infection. So you're left with nothing, and you look at the patient hopeless, and this increases the chances of that patient dying because you have no tool to help this patient.
maybe so far
The population in Kenya that can come to our facility. So in Kenya, roughly approximately 40% of the deaths that have been recorded in the last few years have been because of this resistant organism. Now, closer home to our facility, we look at around 20 to 30% of these deaths that have been brought about by this resistant organism. And that is the reason why we are here today, to educate the masses that there's this small thing that is called antimicrobial resistance that we need to be aware about because of the deaths that we have seen. Today will be you're the advocate of this message that you're trying to put across. You're the champion back there in Matungu or in your small village, that you should be aware that these antibiotics you buy across in many pharmacies shouldn't be bought that way. You should visit a facility, let a healthcare provider write it down for you and give it to you in a proper manner. That would be my message to everyone else within the county.
maybe some of the
That most patients present with, and they tend to buy these things over the counter. Things like headache, fever, a bit of a stomach ache here and there, a bit of diarrhea, a bit of body weakness. You just find a patient going to the pharmacy and buying medication for themselves, and even commonly a sore throat, homa, sore throat. That is what we want you to visit a facility first. Let a healthcare provider be the one to give you that medication.
also you can
Great. The services are actually quite available in our county general hospital, and we actually have a very big machine that has been brought to actually there to make us get these infections quite early, and it is very affordable. It is just 1,500 shillings, and you cannot get it anywhere else in this county. That is quite a subsidized price. So anytime you have a sore throat, diarrhea, we take that sample, and within 4 to 5 hours, you have the results with you, and we can give you the medication depending on what we get. Yes. A start, it is actually in the county general hospital, but we have set aside a phone number that in case a patient needs a sample to be taken, we can just organize for it to be brought from that sub-county hospital to our facility, and the results can be channeled back. So you don't necessarily have to transport the patient to general. There's a phone number that can be sent. The amount of the to be paid can be wired to the general hospital, and we get the results back to you. Yes.